Can the carnivore diet cure autoimmune diseases? Could eliminating all plant-based foods help with autoimmune diseases? The carnivore diet is gaining popularity, but does science back it up? In this video, we'll explore the potential benefits and risks of using a meat-only diet to manage autoimmune diseases. Stick around to find out what researchers say. Watch to learn if this diet is right for you. The carnivore diet is an extreme elimination diet that consists entirely of animal-based foods. This means no vegetables, fruits, grains, or legumes. The reasoning behind this diet is that plant foods contain anti-nutrients, like lectins, oxalates, and gluten, that may trigger inflammation and worsen autoimmune diseases. High consumption of red meat may promote oxidative stress and inflammation, worsening autoimmune conditions like lupus. Mu5GC, a sugar found in red meat, has been linked to immune reactivity, potentially triggering or worsening autoimmunity. Many plant-based foods contain polyphenols, antioxidants, and fiber, which help regulate the immune system and reduce inflammation. Can the carnivore diet help? Some people claim that the carnivore diet helps them manage autoimmune diseases by reducing inflammation. Here are a few conditions that might benefit. The carnivore diet lacks fiber, which is essential for maintaining a healthy gut microbiome. Rheumatoid arthritis, RA. Lectins in plant foods may increase gut permeability, also known as leaky gut. Studies suggest that low-carb and elimination diets help reduce inflammation in RA patients. Leaky gut. Disruptions in gut bacteria have been strongly linked to autoimmune disease flare-ups. Inflammatory bowel disease, IBD. Crohn's and ulcerative colitis. Since fiber can irritate inflamed intestines, eliminating plant-based foods may help reduce symptoms. Studies show that low-carb, high-protein diets can lead to increased cortisol levels, a stress hormone, and ketosis, which may trigger lupus symptoms in susceptible individuals. Psoriasis. Psoriasis is linked to metabolic dysfunction. A high-protein, low-carb diet may help manage insulin resistance and chronic inflammation. Metabolic dysfunction. While some autoimmune diseases might improve, certain conditions could worsen due to the lack of fiber, increased meat consumption, and inflammatory responses. Multiple sclerosis. Limited research suggests that eliminating plant-based irritants may help multiple sclerosis patients by reducing immune overactivity. Plant-based foods may be needed. However, multiple sclerosis patients require polyphenols and antioxidants found in plant-based foods to manage inflammation. Hashimoto's thyroiditis. Since gluten and dairy can trigger thyroid inflammation, a carnivore diet, without dairy, might help some patients. Omega-6 fatty acids from meat may contribute to neuroinflammation. Doctor consultation is a must. The absence of iodine-regulating plant foods like seaweed and vegetables can disrupt thyroid function. Balanced diet plate to meat-only plate. Excessive protein intake can increase thyroid autoantibody levels, worsening Hashimoto's. Research findings. Carnivore diets lack selenium, an essential mineral for thyroid hormone metabolism. So, what does science say about the carnivore diet for autoimmune diseases? Let's look at the evidence. The toxic burden of vegetables hypothesis. Some researchers believe that plant toxins like lectins and oxalates contribute to autoimmune diseases. However, this theory lacks strong clinical trials. Case study, lupus, SLE. Symptoms worsened on carnivore diet. A 19-year-old male with lupus experienced a severe flare-up after switching to an all-meat diet. His symptoms included joint pain, extreme fatigue, and kidney inflammation. When he reintroduced plant foods, his symptoms improved. Possible reasons why some people get worse: high red meat consumption, increased oxidative stress and inflammation, lack of plant-based antioxidants, reduced immune regulation, gut microbiome disruption. Fiber deficiency may worsen autoimmunity. Scientific researcher analyzing data say this: while some autoimmune conditions may benefit, the lack of fiber, antioxidants, and plant-based nutrients could worsen others, particularly lupus, multiple sclerosis, Hashimoto's, and Sjögren's syndrome. More clinical trials are needed to determine long-term safety. Patient with autoimmune disease symptoms struggle. Individuals with pre-existing autoimmune diseases should consult a healthcare provider before making drastic dietary changes. Based on recent scientific research and clinical studies, several dietary interventions have been investigated for their potential to reduce inflammation, support immune balance, and alleviate symptoms of autoimmune diseases. A balanced diet plate is usually needed. The Autoimmune Protocol, AIP, diet best for rheumatoid arthritis, psoriasis, Hashimoto's thyroiditis, inflammatory bowel disease, autoimmune disease visual. The AIP diet is a stricter version of the paleo diet, focusing on eliminating potential triggers like grains, dairy, eggs, nightshades, nuts, seeds, legumes, and processed foods. Using laboratory equipment and test tubes, studies have shown that AIP reduces inflammation and improves gut health. Patients with autoimmune disease should be concerned. A clinical trial on IBD patients, Crohn's disease and ulcerative colitis, found that 73% of participants experienced significant symptom improvement after following the AIP diet for 6 weeks. Doctors and patients should discuss diet options. The Mediterranean diet best for multiple sclerosis, rheumatoid arthritis, lupus, and Sjögren's syndrome. Scientific study results. The Mediterranean diet is rich in anti-inflammatory foods like olive oil, fish, vegetables, fruits, nuts, and whole grains. Who should be cautious? Omega-3. Fatty acids from fatty fish, salmon, sardines, mackerel have been shown to reduce inflammation and support immune regulation. While some autoimmune conditions may improve on the carnivore diet, others might actually get worse. Multiple sclerosis patients need antioxidants and polyphenols found in plant-based foods to reduce neuroinflammation. Without iodine-rich plants, thyroid function may decline. Excessive protein can also increase thyroid antibodies. Sjögren's syndrome affects saliva and tear production. High-protein diets may increase acid production, worsening oral health and dehydration. Balanced diet versus meat-only diet comparison. The plant-based diet whole food, plant-based. Best for lupus, multiple sclerosis, psoriasis, rheumatoid arthritis. Scientific study on autoimmune diets. A vegan or plant-based diet rich in whole foods, vegetables, fruits, legumes, nuts, and seeds has been linked to reduced autoimmunity and lower inflammation markers. Should you try it? Phytonutrients and fiber from plant-based foods help regulate the gut microbiome, which is critical for immune system balance. Before you try the carnivore diet, keep these factors in mind. Limited scientific evidence. There are no large-scale clinical trials confirming its effectiveness for autoimmune diseases. Bio-individuality matters. Some people experience symptom relief, while others get worse, like the lupus case study. Gut health. Eliminating fiber can harm the gut microbiome, leading to long-term digestive issues. Nutritional deficiencies. The diet lacks vitamin C, fiber, and plant antioxidants, which are essential for immune health. The ketogenic diet, low-carb, high-fat. So is the carnivore diet the answer for autoimmune diseases? The truth is, it's complicated. It may help certain conditions like rheumatoid arthritis, irritable bowel disease, and psoriasis by reducing inflammatory plant compounds, but it may worsen conditions like lupus, multiple sclerosis, and Hashimoto's due to missing key nutrients. The best approach? Consult a doctor, track your symptoms, and focus on a balanced anti-inflammatory diet. Balance your plate with various foods. The ketogenic diet, low-carb, high-fat, has been shown to reduce neuroinflammation, making it beneficial for multiple sclerosis patients. The ketogenic diet is best for multiple sclerosis, epilepsy, and chronic fatigue syndrome. However, long-term adherence to keto can be difficult, and some individuals experience worsened gut health due to the lack of fiber. The best diet for autoimmune diseases depends on the individual. Some patients thrive on an anti-inflammatory Mediterranean diet, while others find relief with the Autoimmune Protocol, AIP, or a plant-based approach. Gut health plays a crucial role in autoimmune disease management. Subscribe for more health tips.